Good morning, everyone. Thank you so much for joining us today. My name is Andy Johnston, and I have the privilege of serving as Vice President of Government Affairs at the Grand Rapids Chamber. We're really pleased to be partnering with The Right Place this morning on this town hall to help equip our West Michigan business community with the most relevant information to help you make the best decisions you can for your team and your customers as it relates to the recently published federal vaccine emergency temporary standard. And we know it's raised a lot of questions and concerns. While the distribution of the vaccine has been instrumental in helping West Michigan businesses get back on their feet, and is also a testament to Michigan ingenuity in bringing it forward, we know that this mandate and mandates like this aren't always the best solution for the business community. And after 2 months of waiting and wondering, we got what we expected a couple of weeks ago, which was the broadest and most far-reaching rule that OSHA has ever put forward. The complicated mandate really puts job providers in an incredibly tough position as they work to manage significant talent and supply chain issues during a hectic fourth quarter. And the Grand Rapids Chamber and others have called on the administration and OSHA to reconsider this. And while we've done that, we're going to do everything we can to work with employers and employees to help them through this and work with our regulators should it go forward to make sure that the rules applied in a flexible, common sense manner wherever possible. I also want to let everyone know that we've recently joined with more than 30 business organizations in the state to call on Governor Whitmer's administration to support businesses with the procurement of testing supplies. Should it go forward, there's money already appropriated to do so, and we'd love to see it put to work should the emergency temporary standard go forward. There's a lot to digest in this 490-page rule, a lot of specific protocols, compliance requirements that gives folks or that folks need to understand. And then we have the legal issues with the ETS being put on hold by the courts. OSHA yesterday said they've suspended enforcement. What does all that mean to you and your business? And so what we're going to do today is we're going to connect you with some experts to hopefully relieve some of that stress that the situation is causing. And we're really pleased to do this today. And as this goes forward with partners like The Right Place. Here to introduce our speakers is Brad Comet, my friend and colleague and Senior Vice President of Strategic Initiatives at The Right Place. Brad, take it away.
Yeah, hey, thanks a lot, Andy. Really appreciate it. It's a great opportunity here to partner with the Grand Rapids Chamber to discuss this very important topic. Andy gave a tremendous overview, as he always does, on what is going on. And as many of you know, this topic could potentially have an impact, a vast impact on each of you and how you do your everyday business. So I have the pleasure of introducing our featured speakers for today. Joining us is Jonathan Koch, a partner at Warner Norcross Judd, who specializes in all aspects of labor and employment law. We're also joined by Allison Terpsma. She's an associate at Warner Norcross Judd who practices labor and employment counseling and litigation for employers. We're thrilled to host both of you and hear more about the legal side of how business leaders can best navigate this mandate. Jonathan and Allison, I'll hand it off to you.
Thanks so much, guys. You should be able to see our PowerPoint presentation now. We have a lot to get through today, so we'll go ahead and kick it off. And we will have time at the end for questions. So without further ado, where do we stand right now legally with the ETS? So the ETS was published on Thursday, November 4. It was published in the Federal Register the next day. And then on Saturday, November 6, one of the circuit courts where all the lawsuits challenging this ETS was pending, the Fifth Circuit temporarily suspended the implementation of this ETS. There was some additional briefing that took place, and on November 12, the Fifth Circuit reaffirmed its earlier order halting the enforcement of the OSHA ETS. As Andy mentioned, OSHA has come out and said that it is currently suspending enforcement in light of this order. But that's not the end of the story. The ETS was challenged in a number of circuits, I think almost all of the circuits across the nation. And in those situations, what occurs is there is a lottery system where one of the circuits is selected at random. That lottery took place on Tuesday. And our circuit, the Sixth Circuit, was actually the court that was selected to ultimately decide the fate of the ETS. That there's still more to come. A 3-judge panel has to be selected, so we don't know exactly who will decide this situation. And there will be additional briefing. So in the meantime, the stay remains in place until the Sixth Circuit decides what to do with the case. And of course, it's possible the Supreme Court will weigh in before all is said and done. So for now, the ETS is in flux. We're not sure if this will go into effect or not. But we think it's prudent to at least know what the rule is. And there are certainly some initial steps that we recommend employers take because they will take some time. And so getting ahead of it so that if this ultimately is an ETS that goes into effect, you are in good shape to comply by the various deadlines. So with that, we'll kind of go through the basics of the ETS. Starting with which employers and employees are actually covered by the standard. So nearly all employers that have 100 or more employees are covered by the ETS. And they have said in the FAQ and preamble that related entities may be considered. So various organizations and affiliates that are somehow related may be considered a single employer for purposes of this employee count if they handle safety matters as one company. So if they have general safety policies that cover the various affiliates, they may be considered one employer for purposes of this ETS. So then when you think about your workforce, you might be wondering, well, who counts as an employee for figuring out whether or not we have 100 employees? So it's all employees in all US locations. It's not a count by location, it's the aggregate. You include both vaccinated and unvaccinated employees. You include employees who are working remotely, even if they're not on site, or if they are working outside, you still count them as well. It's not just full-time employees. You want to include your part-time employees as well as any sort of seasonal or temporary employees that you have currently employed with you. You'll want to include them as well. You don't have to include independent contractors or temporary employees that have been provided by a staffing agency. Instead, that staffing agency is responsible for those employees and would count them instead. I did want to note that although certain employees have to be included in your employee count for determining whether you are covered by the ETS itself will not apply to them. So that would be any individuals who do not report to a workplace where other individuals, either coworkers or customers, are present. So that would include your remote workers who work exclusively at home, or any employees who work exclusively outdoors. So there can be a timing issue, right? What if you have a workforce that is in flux, and sometimes during busy seasons, such as around the holidays, for example, you have more than 100 employees, and the rest of the year you have under 100 employees. What do you do there? So the initial count is as of the day that the ETS was published in the Federal Register, which was Friday, November 5. If you had 100 employees as of that date, then you are covered by the ETS, and you're covered by the ETS even if you subsequently drop below 100 employees. So as long as the ETS is in effect, you are covered. But if you had less than 100 employees, maybe you only had 90 employees that day, you are not covered unless and until you hire additional employees that bring you above that 100 employee mark. Once you reach that 100 employee threshold, while the ETS is in effect. If it goes into effect, then you will be covered for the remainder of the effective period of the ETS, even if your workforce again drops below 100 employees. All right, so what do you have to do? So one of the things that we recommend employees still do is at least have their policy ready to go if they need to put it into effect. And that policy needs to be one of two options. Either it can be a mandatory vaccination policy, or it can be a policy that allows employees to elect to either be vaccinated or undergo weekly testing and wear face coverings at the workplace. Notably, OSHA allows the employer some flexibility in this regard, in that employers can even implement a mandatory vaccine policy for some portion of their workforce, and then allow the remainder to elect between either vaccination or testing and face coverings. And the policy itself must include certain required information. We're not going to go through all of that today in the interest of time, but did want to note that we do have OSHA compliant policies available. If you're interested, you can contact John or I after the presentation. And that policy also includes some related documents that we'll touch on that are also required as we go through this presentation. All right, the other thing that you should consider doing while we're still in flux is actually making work of determining your workforce vaccination status. So the ETS requires that employers determine the vaccination status of every employee, maintain records. So it's not sufficient to just have your employees let you know, give you a call, send you an email or a text. You're actually going to have to maintain records of proof of vaccination, as well as a roster of each employee's vaccination status. So if you have a lot of employees, you can imagine that this record keeping and obtaining this information is going to take some time. And so this is something that you might as well get started on, even if the policy doesn't go into place. There's no harm in having that information, and employers are within their rights to ask for this information. You might have some employees say, well, this is medical information, isn't this confidential? And they're right in the sense that although you can ask for it, you then do have confidentiality obligations to keep that information secure and confidential as medical information. The ETS does specify what it considers acceptable proof of vaccination. Again, you can't just rely on what your employees tell you. You have to ask for copies of these forms. So pretty much any proof of vaccination from a public health authority or from a healthcare provider will suffice. Of course, a copy of the CDC vaccine record card will suffice. But it does have to be sort of some form of official documentation. And again, when you obtain these, this proof of vaccination status, this is going to be considered confidential medical information and has to be kept securely by you as the employer. What about an employee who says, you know, I was vaccinated, but I went to one of those early, pop-up vaccination clinics. Maybe it was even while I was on vacation in another state. That vaccination clinic has since shut down. I don't know how to get a hold of my vaccine record, but I swear I was vaccinated. I lost my CDC card. You got to believe me on this. So the OSHA ETS does provide for this situation. Essentially, you have an employee fill out an attestation form after first contacting, either their state health department or their healthcare provider to, again, try to track down their official record. And if they can't, then they can fill out this attestation form. It does have to include specific language, including an affirmation as to the accuracy and truthfulness of the attestation. So this is something that we do include in our policy package, just to be sure you have a compliant form for these purposes. Again, you have to maintain the records of each employee's vaccination status in order to basically verify the roster that you'll keep. And the rule on how long you have to keep these records is essentially as long as the ETS is in place, you have to keep the records securely. And then you have to have a roster. So what this is basically a spreadsheet list of all of your employees, as well as their vaccination status. And it has to specify whether they're fully vaccinated, partially vaccinated, not fully vaccinated because of a medical or religious accommodation, or not fully vaccinated because they have not provided any acceptable proof of vaccination. And this is something that you have to keep up to date and keep maintaining on a regular basis. And this is something that, as John's going to talk about more later, OSHA can ask for. And if they ask for information about this, you have to be able to provide it in a pretty short turnaround time. Employees can also ask for aggregate numbers from this information. So this is something that you'll want to keep updated and is going to be probably a key mechanism between the roster and the policy that OSHA uses for purposes of enforcing, to the extent they get to the point of enforcing this ETS and they receive any sort of employee complaint. This is the kind of thing they're going to want to see first and foremost to ensure compliance. Again, we also include a template of this roster in our package as well. All right, you also have to provide some support for employees who either are mandated or choose to go get vaccinated under your policy. So basically 2 requirements there. You have to provide reasonable time during work orders to go receive those 2 primary vaccination doses or 1 dose for the J&J shot. And you also have to provide reasonable time and paid sick leave to recover from any side effects of each primary dose. So what does that mean? Well, when it comes to getting one of the vaccine doses, you have to provide up to 4 hours of paid time off at the employee's regular rate of pay for each primary dose. This cannot be offset by any paid leave that the employee may already be entitled to. So any sick leave, vacation, or other PTO cannot be used for this. To the extent you have an employee who, for whatever reason, says, it took me longer than 4 hours, you don't have to provide more than 4 hours of paid time off, but you still have to allow additional unpaid time off if they need it, because that's considered protective leave under the ETS. And notably, the time spent getting the dose is not just the 3 seconds it takes for the shot in the arm. It's also time spent registering, completing any necessary paperwork, time spent traveling to and from the vaccination site, that time that you're supposed to stay after your shot to ensure no adverse reactions occur. All of that is considered time that has to be supported by the employer. And then in terms of side effects, the ETS says that, there's no set time that you have to provide, but you're allowed to set a reasonable cap on that. And the reasonable cap they've said is 2 days of paid sick leave for any side effects that the employee might have. And you are allowed to use and make an employee use any accrued sick time they have to cover those 2 days. Or if you have like a combined PTO bucket that doesn't distinguish between vacation time and sick time, you can require employees to use that PTO. What you can't do is, if you do have separate sick and vacation leave, you can't require employees to use their accrued vacation time to cover those 2 days. And you also can't require employees to use basically sick leave that they don't have yet. So you can't force them to be advanced sick leave that will then be offset when they later accrue that sick leave down the road. So with that, I will turn it over to John to cover the rest of the materials.
Okay, thank you, Allison. Thank you, Andy and Brad, for having us to talk about this exciting, probably anxiety-producing topic for a lot of you thinking about your workforce. But we'll get through it. So my portion here is to talk a bit about the testing that happens. Of course, we generally, as Allison stated, we don't have to have a testing component of our policy. We can mandate the vaccine if we think that's the best decision for our workforce or for some of it. But I imagine a lot of us are going to include the testing option as well, because we know we have some employees that are not going to get the vaccine. And this is the way to keep them. And these days, of course, we're all looking to keep good employees and not lose them. So what do we have to do if we're going to allow testing? And this would, by the way, this also would, even if we had the mandatory vaccine policy, we said, hey, everybody's got to get vaccinated, you're still likely to have individuals who say, no, I can't do it because of a medical condition, or I can't do it because of my sincerely held religious beliefs. We've been seeing a lot of those. And if that is the case, then those individuals would be covered by the testing rather than the mandatory vaccine requirements. So for everybody kind of is going to need to know what this process is, again, assuming the ETS goes forward. So basically, if we're going to allow testing, we have to, the employees need to be tested. Employees that are coming to work need to be tested at least once every 7 days. And that is regardless of their work schedule. So if you have a part-time employee, they need to be tested once every 7 days. If you have somebody who just works on Mondays and Thursdays, they need to be tested once every 7 days. So if it's an employee who's not excluded from coverage because they're outside, because they work in a truck all day, et cetera, they have to have that test every 7 days. And then the individual needs to provide documentation of the tests no later than the 7th day following the date on which the employee last provided a test result, meaning every 7 days, not only do you have to get tested, but you have to provide us documentation of that test. I think a lot of employers may want to set a schedule or something, say, hey, Wednesday is test day. You got to get your tests into to Tom on Wednesday. And just to have some sort of order for this process. And by the way, there is an acknowledgement by OSHA that there might be some hiccups here, right? Like somebody might have tried to go to the testing site and they were out of tests, or they like a lot of places didn't have enough employees to administer the tests last night, and so it's a day late, et cetera. OSHA has specifically said if you are exercising good faith to try to comply with the ETS, that's all we're asking. Okay, so even if OSHA comes into your workplace and starts sniffing around and wants to know what's going on, they shouldn't be looking at fines or actions because maybe somebody's missed some days or is a little late on this. As long as we can say we're trying to comply as best we can, but occasionally there are hiccups as we go. Okay, let's go to the next slide. So Allison talked about our policy. Everyone that is covered by this ETS, of course, has to have a policy that explains what they're doing and why. And our policy on testing, if we're allowing testing, must be included in there as well. So this is going to be, how testing will be conducted, how you can provide these results to us, the types of tests that you can utilize, et cetera. And again, this should be in your policy, whereas Allison said we have a sample policy you could work from. There is also OSHA has also offered a sample policy that you can consider. But they've said the test results are specific about what they must include. It has to identify the worker. It has to identify the specimen collection date, the type of test utilized, the entity issuing the result, and the test result. So there's actually a fair bit of information that's going to be required to be provided from the employee and maintained by the employer to show that this was, in fact, a valid test. Go to the next slide. So that leads us to another question a lot of people have. It says, well, what type of tests can be utilized here. And the ETS says basically any tests that is cleared, approved, and authorized by the FDA, including those that are authorized for emergency use, would be acceptable. So you got your antigen testing, your rapid testing, and then you have your I think it's NAAT testing. Those, either one would be acceptable proof for every 7 days, and of course administered in accordance with authorized instructions. What they did say that I think is important is that tests that are both self-administered and self-read by the employee will not be valid unless they are observed by the employer or an authorized telehealth proctor. So, a lot of us have these things, seen these. You can go get them at Walgreens and have them at your house. And what they're saying is you can't have a situation where the employee goes and does this test, him or herself, reads results, takes a picture, and sends it in. If you're going to use this sort of test, it's got to be done and observed by the employer or telehealth proctor. I don't know, that doesn't seem like a process that makes a lot of sense, but it's got to be observed by somebody else. And I don't think they didn't specifically address this, but I don't think it's going to be okay to have your spouse or your roommate or Bob across the street read it for you. I think they're clearly saying we want you to go to a point of care location if you're not going to come into the workplace and get it done. And so that they can validate that, yes, you actually did get the test done and here's the results. And so that's, of course, your urgent care, obviously your doctor's office, your pharmacy, et cetera. There are a lot of places, of course, to get testing, but doing it yourself, which a lot of employees might think is the way to go, is problematic the way the ETS is currently. Okay, so who pays for all this? There's obviously going to be a fair bit of costs in administering this ETS, including with the testing. And the first read of the ETS, sounds pretty good. It says the employers are not required to bear the costs associated with testing under the ETS, but they may choose to do so. Okay, so the employer may choose to pick up the cost of tests, have tests at the workplace. They may choose, if there's any costs with an employee going at a point of care location getting tested, oftentimes that's covered by insurance, which many of us pay for anyway. So I guess you're paying one way or the other. But if there's a cost there, we don't have to pick it up. We can make the employee do it. But I think a lot of employers can be thinking about this and thinking, if we don't help with this, either with the tests or with the cost or with the process or with all of this, we're going to be worried that employees just aren't going to do it or aren't going to do it right. And so we may decide, voluntarily, we want to get involved. We want to buy, a bazillion of these things and proctor them ourselves at the workplace as needed for those employees. It's just going to be thinking about how best to get our employees in compliance and get them to the workplace. So we don't technically have to pay, but we have to make sure this is done. So we'll have decisions to make there. The other complication, sorry to add more complications, but one thing that is not clear is what about the time? The time spent getting a test. Do we have to pay for that? Historically, when an employer requires an employee to go get tested for something, say it's a drug test, right, or a medical screen or something, employers have to pay for that time. So this is a test. It's in some ways required by the employer. Would we have to pay for the time, to them go get tested? I think that's counterintuitive to the purpose of the ETS, which is supposed to be to get more people vaccinated. But they haven't made this clear yet. So we're hoping the Department of Labor at some point will give us some clarification and say, we hope, say, no, employer, you don't have to pay for the time spent going and getting the tests. But that's to be determined. Right now, you may have to. Next slide. Records of the testing. We need to maintain records and preserve them. As Allison talked about, the records of the actual test. This is an employee medical record, so we got to treat it like other employee medical records. We got to keep it separate from the personnel file. We got to keep it confidential. Fortunately, it's not like other records in that it has to be maintained for the entirety of your employment, plus 10 years, some long period. They specifically say these records only need to maintain while the ETS is in effect, which is for 6 months. Next slide. All right, so we have testing. Testing is going to lead to positive tests, of course. And so the ETS also provides for what we need to do when we get a positive test. Of course, in our policy and our information to employees, we have to tell them that, hey, if you get a positive test, you got to tell us right away, of course, which we think is intuitive, but I've seen many examples where employees don't come to the workplace and say, hey, by the way, I tested positive. Oh, fantastic. So we got to have that in our policy and program. Of course, a COVID positive employee must be removed from the workplace. That's regardless of their vaccination status. And just a note too, here in Michigan, we still have the law in the books that says we also have to allow employees who display the principal symptoms of COVID or have had close contact with someone confirmed to have COVID. If an employer reports that to us, we have to take those people out of the workforce as well, which may have been a headache for some of you out there. Next slide, please. So we got to get them out of the workplace. When can they come back to the workplace? There's three ways that they can come back. Number one, they meet the return to work criteria in the CDC's guidance rather. And that is that they have to be 10 days post-symptom onset or 10 days since they had the test if they don't have symptoms, if they're asymptomatic, 24 hours fever-free and all symptoms improving at that point. Secondly, if their doctor says, hey, Tom is better, he's there, there's no sign of COVID anymore and he can return to work, that would also allow us to return the employee to work. And thirdly, if they receive a negative NAAT test, nucleic acid amplification test, I had to look that up again. That's the test takes longer and that's more accurate after receiving a positive antigen test. So if you got a rapid test and it said positive and then you took the NAAT test and it says negative, it's probably a false positive and you can come back to work at that point. Next slide, please. All right, time off. Paid time off is not required when an employee has to be removed from the workforce for COVID. However, if you're here in Michigan, as most of you are, you still have, and you're more than 50 employees, you still have the Michigan Paid Medical Leave Act, which requires us to provide paid sick time for individuals. We have to allow employees to use that time, and we should also allow them to use other PTO time if they so desire when they're on their COVID leave. One note is, of course, there's been contact tracing requirements throughout this pandemic. There's nothing in the ETS about that requires you to contact trace the individual to other employees or outsiders or notify the health department, et cetera. Okay, let's talk about masks for a minute here. So the ETS does require masks for those individuals who are not fully vaccinated when they're indoors or when they're occupying a vehicle with another person for work purposes. Okay, this of course is subject to accommodation. There are some people with breathing problems, et cetera, that may have come to you already and said, I can't wear a mask because of this medical issue. But otherwise, the unvaccinated individuals are going to have to wear face coverings. Now, fully vaccinated workers do not have to wear the face covering. They're encouraged to do so, but that'll be a choice of each individual employer, whether they want all individuals to wear the mask or just the unvaccinated. And they also make this note of saying, employees may not be prevented from wearing face coverings unless the employer can show it would cause a hazard. Similarly, customers and visitors may not be prevented from wearing it. I think this is just, we've seen some rare stories where somebody, because of their political feelings, have said no masks allowed, that sort of thing. That would be a violation of the ETS if someone were to do that. Okay, notice obligations. We have to share a bunch of information with the employees. This includes the requirements of the ETS and any policies that we're implementing, process for determining vaccination status, et cetera. information about COVID-19, the efficacy, safety, and the benefits of the vaccine, freedom from discrimination, retaliation, and penalties for supplying false information. Of course, somebody faking tests, et cetera, that there's significant penalties with that. We have to provide all that information. The easiest way, of course, to do this is to create that policy, that compliant policy that we're required to make anyways, and then share that with the employees and just make sure that it has all this information in it. And we do have to also make records available to a variety of people. So the individual employee, if the employee says, I want to see my vaccine documentation, which probably isn't much, but they want to check it out for some reason, we have to make that available to them. Maybe they're going on a trip and it'd be useful or something to them that way. We also have to make available to the employee the test results required by the ETS, you know, the information on each test if the employee wants to see that. Additionally, if we have an employee representative like a union, we have to make available to them the aggregate number of fully vaccinated employees, along with the total number of employees at the workplace. And these need to be provided in short order, the ETS says, by the next business day. And then further, if we go to the next slide, OSHA says you got to have ready within 4 hours, because maybe we're going to do some broader scans of employee compliance with your policy, and then also with this aggregate number of fully vaccinated employees and total number of employees at the workplace. So this requirement to create a policy, and then this requirement to keep a record of our vaccinated, unvaccinated, that's something that you have to have and make available to OSHA within 4 business hours. So there might be some OSHA, you know, just knocking on some doors and saying, hey, we want to see your policy, we want to see your aggregate number. I think most of what OSHA is going to be doing is responding to complaints. They're going to be inundated with this. They're going to be overwhelmed. They certainly can't go in everybody's workplace and check out full compliance. But I think they'll follow up on complaints that happen. And then also they may do some of this, checking in and seeing, you know, hey, we need to see your policy, make sure you have one, and we need to see your list of employees. And again, they have repeatedly said good faith, if you're making good faith efforts, that does comply with the ETS. So, you know, we're going to talk about dates and times, and, you know, if you don't have everything fully in place, but you're working towards it and OSHA shows up, they're supposed to say, okay, just, you know, you need to get everything in place and not, you know, start out with fines and things of that nature. All right, timing, compliance deadlines. Well, here's the original deadlines. The effective date was November 5. Of course, it was stayed, meaning not in place and no longer currently effective as of November 6, because of the decision of the Fifth Circuit Court of Appeals. If it's reinstated without any changes in these dates, the compliance provisions for everything except the vaccine mandate and/or weekly testing will need to be in place by December 6th. This means we got to have our policy by then. We got to have our record by then. We have to have our process and our information. We have to allow employees to go and take paid leave to get vaccinated. That needs to be in place by December 6th. And then full compliance, meaning the vaccine mandate and/or the testing requirements need to be in place by January 4, 2022. An ETS can only go 6 months. So again, if these dates hold, this ETS will expire May 5 of 2022. But of course, as Allison talked about, we're all sort of waiting on the courts, and we don't know if these dates will hold. I think it's more likely that they won't. And even if it goes forward, that these implementation dates are later, but we do not know that at this point. So that's our program. We tried to just hit the high points. You know, as Andy said, there's hundreds of pages in this ETS, so you could certainly drill down to a lot of detail. But I'm sure you have questions. I've seen some that are posted already, and we're happy to do our best to answer them.
Yeah, thanks, John and Allison. The one that we got first was on that, is it possible the November 5 date change could change regarding the current litigation? And I believe you just addressed that one, so I think we knocked that one out. Can you clarify one of the questions? If an employee working exclusively outside, do we have to keep records of their vaccine status and still have them test weekly?
Yeah, I'll take take this one. Yeah, that's a question I've gotten a few times. The way the ATS is set up, it says that these individuals that work exclusively outside, which means exclusively, right? If you're like in construction and you start out outside and you end up working inside, that doesn't qualify. I mean, it has to be somebody that is outside. They do have a de minimis exception where you have to go inside to go to the bathroom. You have to go inside to get some paperwork if you're driving a truck or whatnot. That's allowed, but otherwise these individuals really do need to be outside. If that is in fact the case, if you have those employees, they are not covered by this ETS. So that means that we do not have to maintain their vaccination status. We don't have to keep that information, and they do not have to have the weekly testing. Of course we can, but there is not an obligation under the ETS to do so.
And sorry, can you just, do those employees count towards 100?
Oh, I'm sorry.
No. I just want to clarify that because that's an additional question we've had is, if those folks that are exempt that you just talked about, do those also count to your 100 number? So, I have 200 employees, 125 of them work outside. Does that mean that those other 75 are still going to fall under these requirements because we're technically an employer over 100?
Yeah, that's a great clarification, Andy, and they do count for that purpose rather. So all employees, no matter what their status is, unless they're not employees, they're contractors, count for purposes of the 100 and putting you under the ETS. These individuals then at that point don't otherwise have to comply, but you're right that the 75 that are not working outside would need to comply in that circumstance.
Because I did have one employer say, oh, I could possibly be exempt from this. I have more than 100. And so they would still have to do all the compliance that goes in there. We had another question. I know we touched on it a bit, but in lieu of requiring personal proof of vaccination, can you talk about employees submitting that testament, or I'm sorry, the lawyer term attestation of something to the vaccination? Can you cover that again, Allison?
Yeah, so I guess the answer is it depends. So that's not the first choice. The first choice is, of course, the actual proof from either with a CDC vaccination card or a proof of immunization from either the public health authority or your healthcare provider. But if that is not available, an employee can sign an attestation and date it. But again, that has to have specific information indicating that they tried to get their vaccine already. They weren't able, or their vaccine record already, they weren't able to do so. And actually has to have some specific language, understanding that they could be subject to criminal penalties if the information provided on the form is false. So it is an option, but it's sort of the last ditch effort and not the first route to go.
Another question here. I know we've got it at the chamber a couple times. If an employee is in quarantine because of exposure, are they required to use their vacation time or PTO for that?
If they're in quarantine?
Yeah, due to exposure, like the 10 days, have to be at home, can't perform their job. Are they required to use vacation time or PTO is the question?
Yeah, so it depends on, I guess, the employer's vacation policy. So you can require them to use that time. Even with here in Michigan with the Paid Medical Leave Act, quarantine should fall within one of the uses that you can use. So that's certainly an option. If it's available for your employees, and the FFCRA is no longer in effect, so we don't have that to contend with.
You took the FFCRA acronym right out of my mouth. There's been a bit of confusion of, was that still in effect? Who pays for those kind of things? We have another question here. Must we still defer to PA 238 of 2020, I believe we're referencing here, as it relates to contact tracing in the event of a positive result in the state of Michigan?
Yeah, that law remains in place, and you guys might know if there's efforts to repeal it. I think some people have been interested in that because it goes on beyond what other states and the CDC is requiring at this point. And we alluded to it in the presentation about, employees still can say, hey, I've been in close contact, I'm going to take the time off, or been exposed, or I'm feeling the symptoms, and have someone take the time off. And we all know that unfortunately some employees have abused that privilege. So that is still the law of the land. That is a past sign. That's it's still in place, and unless it's repealed, that remains something we need to comply with. The other thing I was just going to point out, with the sort of ties into that and the previous question with vacation. The only thing we need to be careful, we absolutely can require employees to use vacation PTO in accordance with our policy. What we don't want is for it to be done discriminatorily, though. So if we only are requiring, COVID time off, you have to use your vacation, but otherwise, if you're sick, you don't want to be in a situation like that, because that law and others protect against retaliation. And an employee could say, hey, I'm being retaliated against because I have COVID or because I was exposed. They're making me use my vacation, when if I was just sick or just otherwise needed to take a leave, they would not. So we do have to be consistent with our leaves.
A little prognostication question here. Is it possible the courts may invalidate certain aspects of the ETS and leave other aspects in place? So the rule is substantially different at the end of all this litigation?
You want to take that one, Allison, or you want me to?
I was saying earlier, I don't like predicting the future. Seems unlikely to me. That's what I would say.
Well, I like predicting the future, although I'm sometimes wrong. I just one thing to keep in mind, I don't want to get people's hopes up that are hoping this goes away, but I guess I will. This is in the Sixth Circuit, which is generally a more conservative circuit. More of the judges have been appointed by Republican presidents than by Democrats. And while they could go to this 3-judge panel, which might result in a couple people that are more on the progressive side hearing this, experts are sort of thinking that they may go en banc, meaning that every judge, every active judge will hear this case, which would definitely put a majority of conservatives deciding this. Now, again, that doesn't mean they're going to decide one way. You can't predict judges just by who they've been appointed by, but it is fairly conservative. So, in terms of removing the Fifth Circuit stay, I'd say that's probably less likely than not. So we probably are at least going to have some additional time. But that doesn't mean we shouldn't be prepared. I mean, it's very easy now and smart to get this policy together, to get our process for starting to gather information together. Lots of employers are asking vaccine status to start gathering that information, even if they're just asking voluntarily, and saying, you don't have to tell us this yet, but it's helpful to us if you can let us know, and so we can start keeping this information. So we should be prepared, because there's no guarantees. I mean, they could remove the stay, and then those dates are in place, and we got to be compliant in a matter of a couple weeks. So we should be ready to move. But for those that are hoping this doesn't come to pass, which I'm guessing is probably the majority on this, because it is going to be challenging, there is certainly hope that will be the case.
Yeah, so still do what's appropriate for you to collect the information, do the counting, get the policy in place. And thanks for touching on the mask requirement too. I think that gets lost in the shuffle a little bit about the vaccines, that, should this have gone forward, that would have been a December 6th requirement for workplaces. Can you touch on maybe what we've learned from other employers that have, and large employers have moved forward with vaccine mandates? Is there things we've learned from them as they've implemented mandates that would be helpful as others are considering it?
Well, yeah, I mean, there are a lot of larger employers that have mandated this. United Airlines is an example of one that's been in the news quite a bit, because they said, either you get vaccinated or you have to go on unpaid leave. And that's playing out in the courts. And I read an opinion, the first opinion, the judges were not big fans of what United did there. So I'm not sure that's going to work out for them. I think prudence is the best course of action here. Those of my clients that have implemented mandates have largely gotten compliance from the individuals, but they've also been inundated with a lot of things, like in terms of the accommodation requests and dealing with those. And in terms of lessons learned, I've learned about all sorts of new religions I wasn't aware of before the ETS, so you'll have people that are going to be pushing back hard on that. So I would just encourage people, before they do that, just to think about all of the impacts. And of course, if the ETS goes forward, then it is providing you some cover with your employees and saying, hey, this is what the government's requiring. It's not us, it's them. And so we have,
and it's wide latitude in terms of that religious exemption, correct? Because I've heard some employers say we're going to take a really open approach to that.
Yeah, that's a great point, Andy. That the guidance on religious accommodation is to provide latitude, really. It's to say that most employers are not in a position to determine whether somebody's religious belief is sincerely held or not, unless they have some evidence that it's not. I mean, if the person has been saying all along that this is their political position, et cetera, and then all of a sudden they say, oh, it's my deeply held religious conviction, well, then maybe that's a situation you got to follow up on. But generally, if an employee says, listen, because of my beliefs and my beliefs about the body and how to treat it and all that, and takes the time to put together an attestation of that, it's a hard thing to challenge effectively. You can ask for a third party or a pastor or et cetera to speak to that, but even with that, or even if they can't get a pastor, it's difficult to prove that it's not sincerely held. So a lot of employers, Andy, I think as you alluded to, have sort of said, if somebody is going to do that, if they're going to fill out the form, if they're going to write it all down, we're going to accept it. And that's easier for us.
Just a couple more questions, and we'll kick it over to Brad to close this out. At this time, if employers are asking for vaccine status, can employees refuse to provide that status until the courts rule?
Yeah, so even before this ETS went into effect, employers do have the right to ask employees for vaccination status. I think the larger question is, if an employee refuses to give that information, like what, how strict do you want to be on compliance? As John mentioned, you can ask and then, decide how you want to follow up if they don't provide it at this time, if they are being slow to respond, et cetera. Because, if you're not, sure how you want to proceed with this down the road, you may not want to take a hard stance on providing the information, even though you can require it if you want.
Thank you. I guess our last question is about predicting the future. So I guess I got to go to John on that. But you talked about whether it might be a 3-judge panel or all the judges hear the case. I know that there's a date for Monday for all the filings to be put in to 6th District. What's the timetable for them making a decision is the question as that goes forward. When are they going to decide, if it's going to be 3 judges or not? And then how does that move forward?
Yeah, Andy, I'd really like you to use the legal term en banc for that situation when they're all. It's important that we use those Latin terms that nobody knows.
Well, I'm trying to comply with the OSHA standard, which says you have to use a literacy level that everybody can understand. And I didn't go to law school, so. Yeah,
well, and we're the worst at doing that. So, but we try. It isn't clear. I'd like to give a more clear-cut answer because they first have to decide how they're going to hear it. And then, they have to give, as you said, I mean, some of this has been briefed already, but it's clearly everybody's top priority. So I'd be quite surprised if we don't at least get a determination on whether the stay is going to remain in place in the next couple of weeks. I think they really have to make that decision because as we've talked about today, I mean, the first implementation date is December 6th, which is basically a couple of weeks away. So I would think their goal would be to at least notify the world, the country, of whether the stay is going to remain in place before that date, so we can have some surety of whether we got to move forward with this right away, or if there's going to be the time for this to go through the Sixth Circuit and have them get a full review, and then even potentially go to the Supreme Court after that, which of course could push it back quite a bit.
Well, very good. Thanks again. Just want to say thank you to Jonathan and Allison for taking the time and providing your expertise. Thank you for all of you that have taken your time to hear from our excellent speakers. Just so you know, the town hall, this town hall has been recorded. We posted on our websites in the coming days for attendees and for those that are unable to tune in. As this mandate continues to unfold, remember that your teams at the Grand Rapids Chamber in the right place are always here to assist you. Please note that following this event, you'll receive a survey from our friends at the Grand Rapids Chamber asking you to rate your overall experience, 1 being the lowest possible score and 10 being the highest. Your feedback is very important. It allows them to continually enhance their events and programs. So please take a few minutes to share your thoughts with us. And with that, this concludes today's event. Have a wonderful week. Have a wonderful holiday next week. So thank you. Have a great day.